some pain medicine for that. Just because of the one extra beat you came in with, it was right, this is the right side of the heart, right at the very bottom, kind of like we thought in the exam. The biggest challenge with it is your ICD lead is right there too. And so we sort of had to come under the lead and treat it, but it's really thin tissue there. And so if we irritate the sac guard, it can make it feel like a sharp pain a little bit. Is that what you feel?
Yeah.
That's been gone for a while, that extra beat. I'll give you something else to help that too. And then as soon as that one was gone, there's another one right in the middle of the heart. We can see this with sarcoid, it just invades the middle. The conduction system from the upper to the lower chamber comes right through the middle, and then it goes down big bundles. It's right on that bundle right here. So we came just to behind it so we didn't injure the bundle and treated that as good as we could. Then there's another PVC over here that was very infrequent, and one over here that was infrequent, and then there's one back here that's infrequent. I want to try a medication because we don't want to keep just treating all these little spots.
Yeah, I was looking on, well, she's still having some on the...
Yeah, you have them all over, and so, but if we can get the dominant ones and then calm it down with the medication, because we would just, what would happen is we would treat the one, you came in every third beat, we treated this one, and then it was every 1 in 5 beat. But I'm going to use a medicine called Sotalol, like metoprolol, but a smaller dose to see if we can calm the other ones down.
Okay.
We can treat the others, we just don't want to keep treating lots of little areas.
So do you biopsy when you're in there? Because I remember one time
they did do
when
it.
they did through the neck or something, they tried, but they're like, it's trying to get the right spot off a Dalmatian. Trying to get a black spot, and it's easy to get a white hair. So.
When we mapped the heart, if we saw big areas of altered muscle or scar, we can direct a biopsy in there. Yours didn't have that, and so which is good, and it fits the MRI and things that we didn't see a lot.
Good.
So the biopsy would have been pretty neat. That makes me hopeful too that some of these other areas will slow down. We've really irritated the heart with lots of adrenaline and lots of pacing. We looked to see if we could get ventricular tachycardia. We couldn't at the end, and obviously now the anesthesia was covering some pain too. All those things can raise PVCs too. But the number you see is, you went from 1 in 3, you're down quite a bit, which I think is good.
Yeah.
We hear, looking at your heart, I don't think you'll ever have 0 PVCs, but I want them to make it so you can exercise and be active and things like that.
Cool. So did you do it through the arteries or the veins? She was wondering about that.
We stayed on the vein side. If this one became a problem, we'd have had to go either across through the heart or artery. We just didn't see enough of that to go after it. And it's, when it has the features that it's not only over here, it's over here on the outside. And so we'd want to see that was really a problem, because sometimes you have to go on the outside of the heart to get it. The big one was right here at the bottom, the one that we saw in clinic that was every few beats, the one that you came in. And we haven't seen that for 2-3 hours after we treated it. But it is super thin tissue, and if I ablate any closer, that lead can become dysfunctional. Because the lead insert's right there too.
Oh, because you would like fry the tissue, then when the lead fires, it's ineffective.
Exactly, right? Or it can't see the heart. Your lead still captures the heart the same way. The way it sees the heart needs to be above 2 volts, it's 5 volts, so the lead's working great. But if we saw more of that, one option would have been we'd had to move that lead to get that area. We could come on the left side and get it sometimes, but the left side actually is a little bit more shallow than the right. And so this area becomes hard from the left side. We can come around on the outside. So there's different ways to get it, but hopefully you won't. We haven't seen it for a long time. Hopefully you won't feel it at all.
Okay, that's good.
So let's work on that pain and get you feeling better.
You were her husband's cardiologist too, but she never talked to you about it.
I know, but I never met you.
She never met you.
I see.
Good.
Old Bill.
So, do I still take my Toprol or no?
No, I'm going to replace it with one called Sotalol, because I really want the heart to be as normal as possible for a couple months.
Okay.
And if you have extra beats early, that's not uncommon because you have a lot of adrenaline on board.
From the procedure today?
Poke the heart a lot. But as you can see, I see it.
So you're gonna give us a prescription to go get that filled?
It's already at Walgreens.
It's already at Walgreens.
Oh, cool.
Okay.
And then what about for pain management for her? What can we do for her?
I'm going to give some Toradol. That usually
Okay.
works the best. We'll get on it right now.
Okay.
To you.
Okay.
We can get more too if need. Hopefully you won't need that though.
Okay.
So hang in there. We've got about 4 hours of lying flat, so we'll give us a chance to work on it. And I'm going to give you the first dose of that medicine here because I want to get an EKG 2 hours after to make sure it's safe.
The Serotal.
Sotalol, it's called.
Oh,
So far.
It's in the class of
Sotalol?
metoprolol. It's in the class of metoprolol, but it's a little stronger.
How you spell that so we can read on it? So
SOTALOL. And when you read it, you'll find some bad things with it because all drugs are crystals. And when you shine a light through a crystal, half the time it curves the light one way and half the time the other way. When they first made Sotalol, one part of Sotalol that curves the light left is toxic. The one that curves to the right is very helpful. So we now only, of course, use
side effects.
we only currently use the one that's safe.
Go to
Obviously.
no, that's good.
So it's very essentially identical to metoprolol,
Okay.
but I'm going to use a lower dose.
Do I just take it at nighttime?
It's a twice a day though. That is one.
I'll
And
bet
then-
that's what your dad took.
And then we like to use magnesium with it to help to minimize its effect on the heart.
Okay.
So
Cool.
Magnesium every day?
yeah, magnesium with it every
Because
day.
I've only been taking it every other day because it makes my feet swell.
Oh, if that makes your feet so, every other day's fine.
Hey, you put her on some of that when we talked to you
Yeah.
before we went to Hawaii,
And it made you swell
so
up.
she'd stay hydrated. You know how girls are; they don't like to get swollen unless you
in
can
Hawaii.
pinpoint where they can get swollen,
I
and
have
sometimes they might like
pretty
it.
ankles.
You got good ankles. You're good. He said you could just take it every other day if that's
Yeah.
what you wanted to do.
Yeah, that would be fine. We're going to give you a full dose today. Again, just because we've irritated the heart.
So what do you think?
Lovely.
She'll be okay? You think, or
Yeah, well, we're going down from every third, fourth beat extra to, we were seeing at the end about every minute or so, and that counters every minute, so about the same we were seeing. So this looks good. I
That's
hope
good.
that it will continue.
so you think and then when do we follow up with you or Dr. Weiss?
We
or-
have an appointment about 3 weeks
Okay.
already set, but if
and
there's
then she chills out at home.
about
We did like
a few days you need to lie down and it can be tired.
you'll discharge her today though.
Yeah, unless we don't get control of the pain or she doesn't feel well, we'll watch her.
Okay.
Hopefully you'll feel better.
And then take it
here
easy
throughout.
for a few days,
Yeah.
and then
No lifting over 20 pounds for a week till those veins heal.
okay.
All right, well, I'll be close by. Hang in there.
Yeah, appreciate it.
You're
Thanks for
welcome.
your help
Thank
and
you.
You know what?
cool heart.
Maybe she can
I
bring,
feel enlightened now.
Better than my drive.
Yeah.
Yeah.
she can come to my house till Monday.